All right, hey everyone, let's talk about something a lot of people are curious about, but not everyone feels comfortable asking. What are the risks of getting dental implants? Well, it's a really important question, especially if you're considering implants and want to make the best, most informed decision for your health and your smile. Now first, let me just say dental implants are one of the most successful and predictable treatments in dentistry today. They've helped millions of people eat better, smile with confidence, and avoid the hassle of dentures. But like any medical or dental procedure, implants do come with some risks. The good news is most of these risks are either preventable or manageable when you're working with a trusted team. Number 1, infection at the implant site. Let's start with the most common one, infection. After surgery, there's always a small risk of bacteria entering the area where the implant was placed. This can lead to pain, swelling, or even implant failure if it's not addressed. But here's the thing, with proper post-op care and hygiene, this risk is much lower than what we are expecting. We always walk our patients through exactly how to clean around the site, what to eat, and what to avoid. And we're here for follow-ups to make sure everything is healing the way it should. The goal is to catch any early signs of infection before it becomes a bigger issue. Implant not integrating with the bone. So next, let's talk about something called osseointegration, which is just a fancy word for the implant fusing with your jawbone. That's how it becomes stable and long-lasting. But occasionally, the implant may not fully bond with the bone. This could be because of insufficient bone density, smoking, underlying health conditions like diabetes, or even grinding your teeth. The good news, I usually identify these factors ahead of time and build a treatment plan around them. Sometimes it means doing a bone graft first, or using a custom guard to protect the implant at night, but it's all about personalization and prevention. Number 3, nerve or sinus issues. Another potential risk, though rare, is if the implant is placed too close to a nerve or into the sinus cavity. That can lead to tingling, numbness, or just generalized sinus discomfort. This is why we always use advanced imaging and digital planning tools before we place any implants. We want to know exactly where everything is, nerves, bone, the sinus space, so we place the implant in the safest and most effective spot. We don't take chances with your health or your comfort. Number 4, gum recession or bone loss around the implant. Now over time, if the gums or bone around the implant start to recede, it can cause the implant to become exposed or even loose. This is often tied to poor oral hygiene or pre-existing gum disease. This is why we always check the health of your gums and bone before recommending implants. And after the procedure, we coach you on how to keep everything clean and healthy, because yes, you still have to brush and floss around your implants. Number 5, implant failure. Now the big one that everyone worries about is implant failure. This just means that the implant hasn't healed properly, hasn't stayed secure, or needs to be removed. The failure rate is actually very low, around 2 to 5%, and especially if you follow post-op instructions and have a healthy foundation to begin with. And here's the comforting part. Even in those rare cases where something doesn't go perfectly, it doesn't mean you're out of options. We can often try again after healing period or with a slightly different treatment approach. So, should you be worried? It's totally normal to feel nervous or want to know all the facts before making a decision like this. But we want you to know is we take every step to minimize these risks. We carefully evaluate your overall health, your bone and gum condition, and we personalize every treatment plan to set you up for success. And we don't leave you hanging after surgery. We follow up, answer questions, adjust if needed, and make sure you feel comfortable every step of the way. You're never just a number, you're part of the dental family. So yes, dental implants do come with risks, but when you're working with a team that's experienced, thorough, and truly cares about your outcome, those risks are much more manageable. And the benefits, they're absolutely life-changing. So if you're thinking about dental implants or you still have questions or concerns, let's talk. We offer consultations where we can walk you through everything each step of the way and help you decide if implants are the right fit for you.